Jane Arnold, Market President of UnityPoint Health Sioux City, is here to talk more about the acquisition. Thanks for being here.
Yeah, thank you for having me.
And we'll talk about patients here momentarily, but we want to talk more about the actual acquisition that happened Monday, September 1st. We know that was a holiday, but business as usual, like the acquisition. So why was the information released the next day? Today we're learning more about it.
Yeah, I think we made an announcement in late May, and there was a ton of excitement, and I can certainly appreciate that there wasn't a lot of information to be shared post announcement up till today. But what I can tell you is there's a lot of rules and regulations of healthcare, and there are a lot of people working behind the scenes to get us to where we are today.
Okay, so do you think that patients should have been notified the day of the actual transition?
Patients were notified appropriately. Our biggest thing was we wanted people to continue to seek care in the way that they had been seeking it. So the patient shouldn't have experienced any difference. Now that the acquisition is complete, we'll continue to take a look at services and look at services that have been discontinued or paused previously and align that with community need to build a plan for future healthcare delivery in Siouxland.
Maternity care and then the trauma 2 level, the services with cardiac. So do you think that will return?
Yeah, so we're taking a look at evaluating all of those needs. Certainly know that cardiovascular services and that comprehensive delivery of care has been changed at the MercyOne campus previously. We continue to offer comprehensive cardiology service at UnityPoint Health. So our teams will work together, and again, we'll look at the community need and align that to make a plan for the future.
All right, so layoffs, will they happen?
Yeah, so one of the biggest things that we're working on for right now is there's a national healthcare shortage. And unfortunately, Siouxland isn't exempt from that. And I think in 2026, they look at a shortage of 3.2 million in physicians, nurses, and healthcare professionals. So what we'll do, both campuses are using contract labor right now to supplement their staffing. And we're hoping that coming together, we can build a more robust, permanent staffing base to better serve our needs and to continue to reduce that contract labor.
Okay, so do you think there will be layoffs?
We'll continue to look at back-end services for efficiencies and put a plan together.
Does this mean you could have hiring opportunities?
Yeah, definitely hiring opportunities, and just really super excited to combine the great things that people are doing at both campuses to build up our core services to enhance that delivery.
Okay, so let's talk about those rural clinics. I know we have a lot of viewers that are in rural areas here in Siouxland. So a lot of Mercy clinics they rely on. Are they going to close? Are they going to stay open?
Yeah, so what they'll see, the only change they'll see right now is the signage. So they'll continue to deliver great care. I know they have providers, really great providers out in those rural communities. So we'll continue to deliver great care. The MercyOne clinics will be known as UnityPoint Clinic, but it should be a seamless in care for those patients.
Okay, so you say a rebranding basically, but you say right now. So could there potentially be changes later on?
We'll continue to look at services and put a plan together of what it looks like, you know, and talk to communities and understand the community need and take a look at those services currently being provided. But right now, our focus is on continue to provide the great care that we're doing.
What was the price tag?
I can't disclose that, but what I can tell you, the acquisition involved the hospital campus, all of the clinics, and the home care services.
Okay, so what about MercyOne Air Care?
Yeah, that's a great question. So AirMed 4 had been providing air transportation for MercyOne Siouxland for many years, and that has been out of Des Moines, and that has returned to Des Moines. Wings will provide air transportation for UnityPoint Health St. Luke's at both campuses.
Okay, so a lot of moving puzzle pieces here. What is the ultimate goal for this acquisition and for Siouxlanders moving forward?
You know, first, what I really want to say is I'm really proud of the teams. They have come together and really have worked really hard, and it's been a heavy lift. I believe that coming together is best for the community. Our community leaders support it. When I'm rounding at both campuses, our staff are excited. I believe that this positions us for better access, stronger care, and definitely a healthier future in Siouxland.
And a lot of unknowns right now, a lot of moving pieces. You're going to come back on and walk us through an update in a month?
Yeah, that'll be great. I'd appreciate a further conversation with you.
Jane Arnold, thanks for joining us.